attendance?
Mrs. Geiger.
Here.
Ms. Vedder. Mr. Rowis.
Here.
Mrs. Edwards.
Here.
Mrs. Labuda.
Here.
You have a quorum.
Okay, thank you everyone for coming. We have a proclamation that's attached to the agenda, being that it's Foster Care Adoption Month, National Foster Care Adoption Month.
What? You weren't there?
I've been working with the commissioner to reform the foster care program to ultimately increase the number of foster care homes in Sullivan County so that we have more kids staying in county rather than going out into a boarding house situation. So at the full board meeting in 2 weeks, we're going to have a presentation for several of the homes that are in Sullivan County. So today I'll just read the proclamation. Sullivan County Adoption Proclamation. Whereas the month of November is a time when we celebrate the children and families that found each other through adoption. Whereas it is essential to publicize and re-emphasize the urgent need to increase the number of adoptions for children awaiting permanent homes. Whereas in the state of New York, 2,178 children were adopted in 2012. Whereas in the county of Sullivan, 7 children have been adopted in 2013. Whereas Sullivan County's future depends on today's children, we are committed to helping all children grow and realize their full potential. Whereas it is deemed unsafe for a child to return to their home, the child will need a safe and stable environment where they receive love, support, and nurturing. Whereas adoption provides the opportunity for adoptive parents to cultivate a sense of self-worth, thus improving and enriching a child's life and providing a permanent family. And whereas the efforts to improve permanency for children in Sullivan County offer children a chance to live in a stable and loving environment and encourages other dedicated individuals to make a powerful difference in the lives of a child through adoption. It's near and dear to my heart. Our adoption was final August 2nd of our 8-year-old, unfortunately from another county. Fortunate for him. So I am on a mission to reform foster care in Sullivan County. I did a PSA on Thunder Radio. Also going to be doing a story with Dan Hust on successful adoptions in the county, and we'll have statistics and numbers to go along with that.
This is a nicely worded.
Thank you.
Yes. And I read it through because I believe that it cannot be said enough that we need in-county foster homes. Not every child can be placed in an in-county foster home depending on what that child's needs are, but the ultimate goal would be to keep the child in county, in their school district, with a family that I can tell you is well screened, and to increase the numbers of in-county adoptions and foster care placements. Okay, with that, we'll move into reports. The HEAL grant update from Debbie.
Thank you. It's a hard act to follow after that proclamation. And,
Amen, yes.
Congratulations to you. In terms of the HEAL grant update at the Adult Care Center, the lobby is getting close to being finished, and we have reached out to the Department of Health to see if we can get approval to open the lobby before the rest of the project is completed. It would ease traffic flow in and out of the building. So we've asked. I'm not sure where that will go. We'll keep you posted. We have had discussions about a potential name change for the facility related to the HEAL grant work being done. Just want to let you know that the last time the name was changed for the nursing home, it took 2 years with the Department of Health. So it was a very long process.
It was changed from what to what?
God, it was way before my time.
Infirmary.
The
It used to be
infirmary,
Sullivan
I
County
think.
Infirmary.
Sullivan County Infirmary, to the Sullivan County. It actually went before the Public Health Council, lots of communication with the State Department of Health to get approval. Just as a FYI, because that has come up as a potential very nice thing to have the name changed simultaneously with the opening of the units that have been redone. So we certainly want the unit reopened before 2 years. So did want to alert you to that. And then for those who were in the budget meeting, we talked, the commissioners just mentioned a little bit about the education and training needs for the staff simultaneous with the opening up of the remodeled units. As you know, we will be having, once all the construction is done, what is now Unit 2 will be a dementia unit, and what's Unit 1, which had traditionally been a traditional long-term care unit, will be a subacute rehab unit. So we'll be looking to be able to take individuals who have short-term needs, both on the clinical need from, for example, an IV, that type of thing, or perhaps somebody who needs intensive occupational physical therapy, maybe they recuperate from a fractured hip or a stroke. So in both of those units, specialized care occurs, and so now that we're very close to seeing the construction being done and preparing to open, we are looking at investment in our staff for the education and training needs that will help us get to where we need to be, both in continuing to provide a high quality of care to all that we serve, as well as having additional specialized care. Questions?
Well, how are you able to function while, you're, how much longer is the construction?
Well, the construction is targeted to be done by mid-December. Hopefully that will be, or as all the meetings have indicated, we're so far on track at the moment, and we're really pleased. It's a lot of collaborative work between the various departments here within the county, as well as the contractors, et cetera, to continue to move the project forward. I don't know if that answered your question.
Well, I think it's because there was at one time, a very difficult decision about the staff that, then the numbers weren't matching, and then having to bring the staff back on, so it's sort of like a rotation going around, and I just was wondering how you were coping with all of that.
It's always challenging, but actually very positive in
Good.
terms of I have found a excellent team at the nursing home, both internally and then again, from working within the county, I've had the opportunity very early on in my tenure here with Sullivan County to be able to communicate and have a lot of work with other departments. So when you pull together the internal, which we've been prepping our internal staff as far as the various changes, communicating, working with resident council and family council for their knowledge base, and then the various departments here, we are on track. But as with any change is always challenging, but this change is a good change, so it's a good challenge.
And are you seeing positive results, or it's too early to tell?
Right now, we're in what I call the transition phase, because the unit that has been reopened, which will be the dementia unit, is right now not functioning as a dementia unit, because we have other individuals in that unit who eventually will not be, because they're diagnosed, they're not individuals with dementia. So we're really in a transition phase.
So it's too soon to tell, but
Yes.
it's going the way we think we're gonna reach our destination, we'll get there.
Absolutely.
Thank you.
Any other questions?
I'm just wondering, in the adult care facility, are all of them Sullivan County residents? I mean, do
It's-
they live in this county?
It's not a requirement to be a Sullivan County resident to come to the Sullivan County Adult Care Center. I have not run statistics to show for myself, but just in terms of the way a nursing home functions, you're not limited to Sullivan County residents. However, based on the people I interact with, the families and the residents, certainly the high majority of people would be from Sullivan County. But I'd have to run those statistics, but it would not be a requirement that you had to be. Part of our mission is to serve the residents of Sullivan County, but as a nursing home, and then, having the specialized rehab unit, we would be able to serve other people who perhaps could come to the hospitals within the county who need discharge plans to our facility, or who have family members who live within the county that would like to be able to visit their loved ones locally.
Thank you.
You're welcome.
Thank you. Homeless housing update, Commissioner Parker.
The current number, we've just on a monthly basis been reporting to you the number of individuals and families in motels. As of 11/4, the number of individual singles are 30 in motels, and they are in eight different motels. A month ago on 10/7, there were 36 individuals in the motels. The number of families is 18, and those families are in 5 different motels. And the number of children in those families is 38. And 1 month ago, there were 17 families, so it did go up by 1 family this past month. We do, Giselle Steckedy, our Director of Temporary Assistance, and Kevin Bennett do have a plan in place to address transitioning some of these families. And there have been many meetings, internal meetings with Mary Marino, Kevin, and Giselle and myself in terms of transitioning families from motels into semi-permanent or permanent housing. So that number should start decreasing with the families.
What was the high, when we were at the height of this?
Man, at the end of, on September 30th, we had 57 individuals in motels, and
We don't have the number.
Do you remember what it was?
Family-wise or total?
Yeah, just to get a sense, because when we took that tour, pretty much every place was fully occupied that we went to, except for one. Remember, when we did the tour of those 5? So I'm just curious as
The
to,
highest since I've been here that I recall was 120.
and we're now at
30.
30.
And you would contribute that decrease to connecting families to get,
Well, I think it's coupled with the front-end detection in terms of, are people residents of Sullivan County, coupled with, do you have other family resources, friends, et cetera, to stay with, coupled with, more focus if they are in a motel and shortening that length of stay in a motel and getting them, permanent housing. I think the 6 leaving in the last month is attributable to the creation of the residence in Monticello, where I think we now have 6 individuals.
And that's
who are
monitored
reside-
by the DFS.
That's monitored by DFS, by our case manager, housing case manager, Rosie. And we have a contract with RSS, a homeless contract.
so, just the transition for 6 individuals, that's in one, boarding house type facility, and DFS monitors those people to make sure that they're, looking for jobs maybe, or, I think that's excellent.
It's
They've been
amazing.
doing
It
great
was-
in that location, case manager.
They have
goes
been
out
doing
quite
well?
often, and every time she goes out, they're vacuuming, cleaning. She's actually been impressed with the way they've transitioned to the home.
Has there
Oh.
been an agreement in place? I remember at one point, we had looked at Delaware County's agreement that they had for clients to sign, such as,
There is an
maintaining the
agreement
property
between
and.
the landlord
Mhm.
and the individuals that are occupying as to their responsibilities and what they're required to do, as well as what he's required to do. The landlord's been great also, and he has a caretaker there, and he is also working with someone else from RSS that he's hired on the side to provide another piece of case management after hours and weekends. So
This is a success story in my
really
book.
good. And we are moving a family to another location, next Friday,
Under the same model.
under the same model.
So in removing them from the motels, when we did the tour, lacking kitchen facilities, very, very small, you know, what I felt was inadequate, so I'm really excited about that transition. Now, is there a plan to do, another, agreement with another housing, landlord?
We're working with multiple landlords. Right now, part of our discussion has been security agreements with them. Because as we, transition to other kinds of housing, they do require security deposits. So we've been working on how we can do that and just identifying there's a lot of available housing. So trying to work with the landlords on this kind of plan, and a lot of them have been receptive, so.
Are, in any of these cases, are the landlords living on site?
Well, with the one we have now, it's just a caretaker, he doesn't live there, but he's active in the community, so
Uh-huh.
he's there quite often. The other ones that we're looking at now are, like realtors or leasing companies, so they wouldn't have an owner living there either, but they do have caretakers.
I see. And so when we were at the height of the costs, because two things happened, right? First was negotiating with the motel owners.
Right.
And that was done, the costs per
Yeah.
night or whatever were cut in half.
Right, a year ago, there were 10 motel owners. We, in the past, were paying $300 a week. We reduced that to $150 a week on singles, so we cut that expense in half.
And that, do we have any ballpark figures as to how much was being paid at the height of the, of that? We don't have them, okay.
Mary's not brains over that.
Well, we can get them. Okay, I just wanna see how this has been phased in. First move was cut the costs. That happened.
To reduce the cost.
Reduce the costs. Second was to identify which ones really need, housing, or which ones
That were
are.
truly homeless and needed to be in a motel because had no other place to
Right.
be.
The third thing that we're doing is with parole on the state level, that they're not just, that's a whole big nut to crack.
Right, that's next on the agenda.
Yep, okay, so I won't jump your agenda. And then the last thing is, this is, I have to be clear on this part. This is still transitionary housing.
Right.
So they're not going out the front door and coming back in the back door. That was one of the revolving problems that we had.
Right, the
So-
goal with the 6 in the transitional housing is to help them get on their feet, to coordinate Center for Workforce Development, any community services, services that they require, and to, you know, the big key is the job. If they can get employment and get on their feet, then they can be paying on their own.
Mhm.
Look, it's a win-win. I mean, reducing
question.
costs and placing these people that really need housing in more adequate housing than we had last year. So,
And reducing costs. I mean, it's a four-pronged approach, and I think we're still at the very beginning stages of this.
And the families is a big focus now, because we have, you know, the average length of stay, and, you know, in six different places. I mean, at the one, it's a 21 days the family has been there. At the one motel where families end up going, it's 636 days. So we have some families that have been in motels for almost 2 years now.
Isn't also the what's considered temporary housing in New York State is 60 months, which is like 5 years or something? That's a requirement?
I mean, it's a priority of the department to get the families in housing other than in a motel.
Yeah,
I mean, it's-
okay, so you're accomplishing that goal.
By the end of the year is the hope, with those families, to get them in, out of the motels.
excellent. Okay, thank you. Any other questions? Okay, number 3, prison releases. I just want to give a little background on that. In 2011, the state parole department released 90 prisoners into Sullivan County. I had asked, legal to, explain if there's a state regulation, why we had 90. There is a state regulation that if they're prosecuted in a county, when they're released from prison, they come back to that county. That accounted for 16 out of the 90 releases. In subsequent conversations, I set up a meeting with the assistance of Sam Yasger, our county attorney, to bring the New York State Department of Parole to the table, which occurred on October 29th. And the goal was effort through law enforcement and health and family services with the Department of Parole to reduce the number of prisoners released into Sullivan County. Law enforcement was well represented. We had representation from the DA's office, from the Liberty Village Police, from the Sheriff's Department, Jeff Molinelli and probation. And long story short, I had a conversation with Steve Claudio from the Commissioner's office, because a lot of information went around in that meeting. The bottom line is that the Department of Parole is willing to work with the county to better review these parole releases coming in. Because it looks like I received where the parolees that are coming in had lived prior to, and a lot of them were Sullivan County addresses. But when we looked closer, they seemed to be Medicaid shelters that are there, and different points of entry into Sullivan County. So now, with communication improving with the Department of Parole, the Commissioner will explain that we'll be able to review these cases. And because the goal of the Department of Parole is successful re-entry for those people coming in. And when we looked at the numbers coming in, 67 in 2013, and we looked at, whether they're reoffending, whether they're winding back up in jail, it was a high percentage. So in my way of thinking, it's not successful reentry. So with increased communication with the department, I think the Commissioner can explain what we're hoping to fulfill.
So we met with parole officials, as Legislator Geiger mentioned, and we had looked at our data. We had 67 individuals released from Department of Corrections in 2013. What happens is the Department of Corrections is required to notify DFS if the individual is going to be homeless upon release. 65 of the 67 individuals were identified to be homeless upon release. So what we have done in 2013 is had to house 65 individuals in motels. When we look at those 67 individuals in total, probably on average we're housing them about 60 days in motels. We're paying out of safety net funds for the housing, authorizing food stamps, and then also Medicaid upon discharge. What we had asked parole to do is, again, as Legislator Geiger had mentioned, the pre-incarceration address was typically seen to be a motel. So you had individuals who maybe were not truly residents, long-term residents of Sullivan County. What parole has agreed to do is to work with us pre-release and even in filling out applications for public assistance or getting an appointment at community services. I mean, we often, it seems like on Fridays at the end of the day, the parolees are showing up and needing housing. So I think one of the good things from the meeting is they have agreed to work with us in advance. Other counties that have more discharges, and I can't remember the term that parole used, but it's a pre-release committee that they have in the community. So I think we're going to develop a kind of quasi ad hoc pre-release committee so that when we get these individuals these notifications, we can assemble that team and ensure a more successful transition, or push back on occasion when necessary with parole to say we do not believe they're going to be successful in Sullivan County for the following reasons. So I think we had a good first step in that meeting. We're gonna continue to dialogue with parole. And the tougher subgroup within the 67 are the individuals who are sex offenders. And in terms of locating them, housing and employment, et cetera, that becomes a little more difficult.
Oh, can I make a comment here, Cindy?
Yeah, go ahead.
Because Cindy and I had worked with Scott Kinney, the Liberty Chief of Police. I'd say, and Kitty, we all started to look at why the police department in Liberty was getting all of these people who were released from the state penitentiary after community services was closed, where then they have the quote-unquote point of entry. And, you know, you could just see by the numbers of how many put their future residence at 16 Community Lane. First of all, it's not a residence. We all know that that's an office. And they have, you know, office hours. So I think that by, you know, having Scott Kinney here, as representative of Liberty, you know, we take a disproportionate number of this particular population because of the location and how much time is
Yes.
spent by the Liberty Police just on transport and you know, this kind of thing. It's not really the way we want to continue, if I can put it that way. And I think that this meeting was very important to have face-to-face with 3 people from the state parole, because they were actually much more receptive. The comments I'd always heard before that is, oh, it's state parole, you know, forget about it. So I think it's important that we've established a face-to-face relationship, we have goals, and that they're willing to be partners with us in those goals, which I think is a relief to me.
I agree. Okay, any other questions?
And so of the 30 individuals in motels, right now 9 of them are parolees with that quote-unquote sex offender classification.
Okay. Okay, thank you. Number 4 on reports, foster care quarterly financials.
That one we were thinking we needed to present in December, if that's okay.
Yeah, that's fine. I think, you did that last month, if I recall, right? It was the month prior.
Well, we caught the year up in, I believe in September, so I think we will always be 1 to 2 months behind.
Okay, thank you. Okay, presentation, person in needs of supervision process. In reviewing the process of PINs, from what I understand, there should be an effort to communicate with the schools. So I had been in touch with Commissioner Parker to commence a meeting between both the superintendent that oversees the 15 schools and have a increased communication with the department as far as children that are possibly falling through the cracks. So I did ask Commissioner Parker if we could have a presentation on the PINS process so we understand how that works in relation to the children in the school district and family services as well.
So I have Barbara McKinney is our Director of Services at DFS, and Colleen Cunningham, our Senior Attorney. And I don't know if you guys just wanna talk in general about the PINS process, how that works in Sullivan County?
Yeah, in general. I didn't know we had to do this today. I was off yesterday, so I'm not completely prepared. But we received referrals from schools and parents regarding kids that are considered to be beyond the lawful control of their parents. They're truant from school often. They break curfew. They may be involved with drugs and alcohol. They have not necessarily committed crimes. When we receive those referrals, we meet with the family. We assess their needs. We talk about what services are available that could possibly help them. When we receive referrals from the school districts, there are requirements that they need to meet prior to asking for the PINS referral. And even with those cases, we also have to make the effort to provide services and see if we can change whatever behaviors are going on in the school and at home and in the community. We have service providers that we contract with that go in the home and work with the family and make an individual plan for the kids and help monitor the status and if there's improvements or not. The majority of the cases move forward with improvements in the home and in the child's behavior, because this is not just about the child, it's also about what's happening in the home and what the parents need to do to get involved and support their children and better supervise and other things. Some of those referrals do end up as petitions for family court because there has been no progress and sometimes no efforts to move forward. Once they go into family court, then the judge can decide if he wants to order the continuation of services with the child in the home, or if he wants to place the child with us, and at what level of placement.
The age of the kids, Barbara, is it 7 to 15 or 7 to?
7 to 18.
7 to 18 now.
A couple of years ago, it changed to include 16 to 18-year-olds also.
So, and then DFS is the lead agency
We're the lead
for the
agency
pins.
in our current process, but we have been meeting with the probation department in order to look at a prior process that we felt was very effective and move back towards that, where it includes other partners in the community, meaning probation, mental health, individual families and school districts involved with them, to come together as a group to plan and carry out those plans. So we've been talking about how we can get that done, and an agree, trying to make an agreement about what the process will be.
So in the quote-unquote old days, a potential petitioner could just say this child is ungovernable, unruly, incorrigible, and refer them directly to family court.
No.
And then in the PINS legislation,
Change that.
change that, so now you have to offer an adjustment period.
Yes.
So,
Right, and, I'm sorry, I didn't mean to
No,
interrupt.
go ahead.
The clerk of the court is not permitted to accept a petition without documentation of those efforts and a statement that there's no substantial likelihood that the child and the family will have any further benefit from the services. Now, that doesn't mean there won't be further services. When the case gets before the judge, he may take a look at that and say, go back and do some more. We have the option now with the new legislation. I say new legislation, but it changed in 2005. If the parents are not assisting, or they're not taking the child to the appointments, or whatever it is that they're not doing, we can have the power to go to court now and ask the court to order the parents to participate. Prior to 2005, the PIN's focus was just on the child. So we have that ability now. I should say that legislation in 2005 was aimed at reducing placements and reducing petitions. That was the goal. When it was passed in 2005, it was passed as part of a budget bill by Governor Pataki at the time. We were required to choose a lead agency. Sullivan County chose Department of Family Services as the lead agency, and we're required to diligently attempt to prevent the filing of petitions and the placement of youth in foster care. As Barbara said, we've been working with probation to try to put together a team so that we start at the very beginning with all of the players looking at the children. So we've spoken to community services about having someone from them, because some of these kids have drug and alcohol issues, some have mental health issues. Some kids may need a little more supervision, so there'll be an assessment about whether it should be a preventive case with social services or more of a probationary function. So we're looking at all of that and trying to work on a team or a committee that will do that. Obviously, that committee will include members of the school district, invite them in to be part of that.
Okay, I think, because of the legislation, that was changed in 2005, from what I understand, the PINS process is more cumbersome and complicated now. Is that the case, where there's less PINS petitions being filed now? Because I believe compared to the numbers in the past, from what I'm hearing, there's not as many, PINS petitions being filed because of the difficulty in, the paperwork and the requirement through the state. Am I correct in that?
It's not really,
Sort of,
I
but
guess.
Because the numbers have
partially.
dropped from what I
Yes.
understand,
Yes.
and that's why, I had felt it was important maybe to touch base with the BOCES superintendent, because I'm hearing, as well as the chair of Health and Family, that some children in the school district are falling through the cracks. Why is that happening? I'm trying to figure out. The PINS petitions are down. When I reviewed that piece of it, I understood, the state change in legislation made the process more difficult, and so we see possibly more, cases coming through, maybe a hotline call or something rather than the PINS process. Would you say that that's accurate?
Without having actual numbers, I really can't say, but even for those children that come through CPS, when it really is a PIN situation, referrals are made, for
Right.
services in the home to address the issues.
Right, I think that's why the county was kind of picking up that gap and, trying to make sure that the concerns were addressed with the children. So that's why maybe your petitions through family court went up, not necessarily through the PINS petition process, because those numbers were lower.
A lot of these cases, get adjusted, meaning there's success, and then they're closed, like behaviors change, kids start coming into school, they participate in counseling, we try to hook them up with community activities or school-related after-school activities so that more of their time is supervised. A lot of times it's issues that the parents have that impact the children, so we try to address those issues also.
So in your, with all the knowledge that you have about the process, do you feel that it would be, a good effort to touch base with the superintendent of BOCES and try to address some of those, children that maybe should go through the PINS process or an alternative to address those issues?
We've had numerous meetings over the years with superintendents, principals, social workers. Every year before the school, as school begins, staff goes in, asks the school to identify a contact person. They visit the schools at least once a week, where the school has the opportunity to present issues and problems and discuss them, and also make a referral for services.
I think it's a good idea, because I think one thing Colleen and Barbara have done with Jeff Molinelli is, re-examine the whole PINS process. And I think several years ago, there was a multidisciplinary team that I think I'm not sure the reasoning at DFS disassembled the team, I think, at some point. So it probably is good, now that they've had several meetings with Jeff, to have a meeting with the BOCES superintendent and or other superintendents to sit down and talk about the process. And a lot of it is on preventive services caseworkers that Barbara has, in terms of the workers. So it's probably a good time to reconnect.
And we
Okay,
do have
thank
them
you.
visiting every school district, including BOCES.
Right.
At least once a week, a worker goes into the school.
But the legislation was intended to prevent kids from going to family court, and sometimes petitioners want the child to go to family court. And what we often find is, if the school had notified us earlier, then maybe their frustration level would decrease.
So what was
the schools.
ultimately the goal of that PINS legislation?
Was to get services to the family. So
Not just the individual
to
child.
reduce
Without taking a court
To
case.
avoid the
without
court
having to go
cost.
to court.
And the one other thing that the legislation did was, I think the prior PINS, and Jeff can correct me, there was a time limit on it. This is open-ended.
Right.
It can go on for, I wouldn't say forever, but there's a period of time where we review and say, okay, it's been adjusted, or we need to do something further. It'll also put more responsibility on the schools, because they need to document the efforts that they've made to either address the truancy, the behavior in school, and all of those things.
So documentation on the school is a vital piece then?
Yes.
And we've met with the schools periodically. we've met with BOCES, was it last year?
Last year.
We had another presentation, we reviewed everything, and we encouraged them in September. You know, by October, you're gonna know if you've got a kid that's missing school, that's a problem. You've gotta come to us early on, because if you wait till April or May, the school year's over.
Too late.
And it's hard
Okay.
for us to address those issues.
Okay.
And that's been an issue in the past, that the schools would refer to probation, truancies, end of April, beginning of May, even end of May, that the kid has, 70, 80 legal absences. What are you gonna do with them? They're not going to be attending summer school, so it was a waste of the resource. And that was part of that, the change in legislation was to limit access to family court for those type of cases. That
Was it successful?
it was absolutely successful.
The legislation worked?
The way legislation works, I've been in contact with other departments, and they pretty much handle it the way, Sullivan County's handling the PINS process.
And how
Better
does
for
it-
the kids, would you say?
I think they get more services than they used to. I mean, the original legislation was 1986, and I remember that because Bill Moon hired me when the PINS legislation went into effect in July of '86, and whereas families before could walk right into court and have their case heard, but there wasn't a lot of services that, the legislation then provided more services to a family. So you may get a 9 or 10-year-old child whose parents are separating, in the process of separating, divorcing. Child begins to act out, and and driving to school kind of crazy, and school not knowing what to do. But when you had that multidisciplinary team in there, you could kind of figure out, okay, well, child's upset about mom and dad potentially splitting up and is acting out. So when you could address the underlying causes, it then decreased the child's behavior. So I think kids get more service, more comprehensive service now than and now with the 2005 legislation, if parents aren't, the PINS process typically in the past put all of it on the child. Now, since '05, we are able to hold parents accountable for their actions and go the child protective route if need be.
Okay, I get it, yep.
But I mean, with schools and everything that they have going on, it's easy for the communication to break down, so I think a meeting is good.
Okay, and I'll be setting that up, and I would like to see Jeff and
Do you have a dedicated
Colleen
PINS,
too.
probation officer, or it's
a little,
spread out?
that's the little fly in the ointment. We used to have 3 officers solely dedicated to juveniles in the past. We now only have 1 officer. And
That's why you, on that org chart, you
Yeah.
put that all of the, people of certain age are spread out throughout the whole.
That's correct.
I got it.
So right now, we just have 1 officer, and they're a hybrid caseload. They do both investigations and supervision of
And there were
juveniles.
like 125 cases?
That caseload is relatively small, but it's deceiving because it's a high-risk caseload.
I
It's
see.
probably only 50, but they wind up doing a lot of investigations. So, to provide appropriate supervision with probation as a partner, it'll be a bit of a challenge. We really don't have the staffing. Like I said,
Right.
before we had 3 dedicated officers, now we have 1, and they do other functions within the department.
So when you had those 3 dedicated officers, that was all they did was PINS?
That's all they did was PINS, that's correct.
And am I correct, though, that the 50 is the total now, although they're more difficult? I'm just still confused.
They, previously, when we had the 3 dedicated officers, they had a staff, they had a caseload of about 70.
Per person.
Per person, which is a little onerous, really should be
Right.
around 50. Anything above 50 is a challenge.
Right.
And like I said, this office is also writing predispositional investigations for the family court.
And a lot of,
And they do intake also, with family offenses, domestic violence complaints that come in. So they're doing
we'll cover that
a lot of juggling.
we'll cover that in our
Okay.
public.
Yeah,
safety.
okay. Thank you. Discussion on Center for Workforce Development update. I had, touched base with Laura back when we had committee meetings, and, we had discussed kind of a solution to, the Liberty Department, that CWD would have a presence over there, and I just wanted to know if we could update on that, and, kind of where that got left off.
For
last conversation that was had was almost a year ago on that.
Is it that long ago?
Yeah, and there really hasn't been any discussion about that per se since then. Giselle and I met in August, in the beginning of August, and then again towards the end of the month, and we actually at that time talked about the employment coordinator actually coming down to Monticello. And I don't know what happened, you know, with that, because there's a desk
Okay, so
down there.
there was a position there that was going to.
There was a Liberty position that could come down to Monticello. But I don't know what happened with that. We didn't get an opportunity to follow up, but that's really been it.
Okay, cause I think the goal of that, was to have, presence in Liberty, being that, you know, we're trying to work with those people and get them into job placements and stuff, so maybe Commissioner Parker can, fill in.
And how are the Ideal Snacks, people who are the long-term unemployed, do we know how they're doing?
Yes, we followed them all the way through September. I'm putting the report together for you right now. Out of the 5 that we followed, 3 are still working there full-time. They haven't gotten increases, but their cases have closed, and they're just receiving SNAP, right now, and 2 of them moved out of state.
So part of that drive was like any, on a voluntary basis, this has to be very clear that it's on a voluntary basis, but any entity like Ideal Snacks that gets a certain amount of tax abatement is willing to take on long-term unemployed and help them, get back into full employment. So we were kind of looking at Ideal Snacks as a small little test case. Let's see what's good, what's bad, does it work?
Right, and my follow-up though was really just with the 5 individuals, because speaking
Of the long-term unemployed, yes.
Yeah, the 5 that we chose to track, because.
And they were willing to be tracked.
Yes,
Just wanna make
yes,
that clear.
absolutely, they were. And we didn't really have, much discussion with the employer. It was really tracking those 5
Okay, good.
folks.
So I'll wait for you.
Yep, I
Thanks.
should have it done about another week or so.
Okay, so at least it's, we knew there'd be a drop-off, but at least we know that it's something that we can look at to apply in other cases.
Yes.
Thank you.
I think the discussion was to increase presence in Liberty. Randy, do you have a,
I think with CWD, discussion a year ago, is gone with, where does CWD belong? Is it belong within DFS? Does it belong within planning? I think with the change in the commissioner and planning, that those discussions have not occurred. In terms of us being able to get people off temporary assistance, using the parolees as an example upon the return, we really need to get people actively engaged in job search, job prep, job readiness. In an ideal world, this contract that we purchased through planning for the workforce development, those folks would be integrated within the Liberty complex. That's still, probably left up to a new commissioner in planning and dialoguing with that person, when they come on board. And in the interim, we have our employment, person, Kim Martin, who gets actively involved in the temporary assistance cases and people's participation in employment. So I know Giselle has wanted Kim to come to Monticello and, participate in orientation to make sure the individual applicants are in compliance with their work plans and goals, and if not, to sanction accordingly. So, but I still think there's a bigger overall, where does CWD fit into the structure?
okay, and I think, we should have some further discussions on that, because the way I remember, we were going to see about, a position moving to Liberty to work in the department on, the employment issue, because the goal is to have as much assistance up there to get the people moved into the workforce. So, I think we can, further that discussion and make up, because I know at one time we had a plan, but
We had made a proposal
last year, for one of, the CWD staff, folks to be up in Liberty.
Okay, that's what I was
But
talking
that,
about.
you know, but nothing moved on.
Okay,
So.
okay. Are there any questions for Laura?
Can I just add something?
Giselle?
We were just working with CWD yesterday and, arranged technical assistance with OTDA representatives. So they were also there yesterday to strengthen the orientation and
What's
the assessment.
Well,
I'm
Greg
sorry,
Betty.
Office of Temporary Disability Assistance. There's a state governing authority. So, to have them come in, cause when we had, gone to the orientation, we had shared with Peggy Marchese, there were some areas that weren't really focusing on why the individuals were at the orientation and, you know, why they needed to find employment and how they could keep their benefits, or actually we wanted them to become self-sufficient. So we did have the OTDA officials there yesterday and spent most of the day there speaking with all the staff and Peggy, and showing them different reports that could be run on participation and engagement rates. So we're really focusing on strengthening that part of it, so that individuals understand why they're there.
Very good, thank you,
If I could
Giselle.
just share something, within CWD, within our welfare to work program that we do, you know, I meet with the staff pretty regularly, and we made a decision quite a while ago, to focus on certain targeted populations. And we focus, I've had a staff person for a good 8 or 9 years now that focuses solely on the safety net, that's their caseload, because of the county cost of that. We focus very heavily on the folks that are 60-month or more, because that's a stronger cost to the county. And so we have, within our office, we've zeroed in on certain, either high risk because they need more intensive work, like the parolees. We have 21 parolees right now that we're working with. We have our homeless population because of the cost to the county. So we have pulled out and we target very intensive services to specific groups. And so I don't want anybody here to ever have an impression that we're really not finding people work, or we're not. We work very, very intensely with the hardest to serve and the longest, the longer term folks that are in there. And we do get them work, and we do go out to businesses. We are drumming the employment up for them.
Can I ask a question in
Sure.
that realm? There are a number of businesses, I don't know how else to phrase it, that, like if you're a waitress, it's not necessarily minimum wage. Some jobs are not necessarily minimum wage because it's counted on as that they would get additional income from tips or something else. Do you help those employers who have those alternate jobs, such as your cab ride, I mean, cabbies don't normally necessarily make minimum wage, they get funding in other ways, and I'm always hearing things on the radio looking for jobs looking for people to come to work for the cab companies, and what are you doing with those jobs?
The folks that, and actually we have 3 people right now that are part of a group that we've pulled out of people that have been receiving assistance 60 months or more. And 3 of them happen to be waitressing. And prior to the recession, when the numbers went through the roof when the recession hit, how we worked with those folks is we have a family income growth plan that we work out with folks when they come in. And we take them through the steps of you're receiving public assistance, let's get you working, then we look at your budget again, and then what do we have to do to help you move off of your cash assistance? So in the case of a waitress, is it more hours? Is it a different place of employment? Is there anybody else in your household that needs to be employed? Anything to increase that household income. For some that are one waitress, she's working full time. But it's a tough business, especially on the off season, to make adequate tips. So with her, it's how do we get you into another line of work? And how does that, where do you live, what's your transportation situation, and whatever. So right now we have a dozen folks that we've pulled out to go back to what we did prior to the recession and to do that plan, that income growth plan, to help them replace over time all of that stuff. And when we're working with businesses that we work frequently with that hire many of our folks that are on public assistance, we have established relationships with them. And we do go out and we do visit those employers and we do talk to them, and we talk to them about increasing, starting wages, increasing the hours that people are working so that people can earn the money, especially our safety net individuals that tend to, and our parolees, that there's not a lot of employers that will hire parolees. And the ones that do tend to pay minimum wage. So when we're working with them, how do we get them to increase their hours? How can they what do they need to do to get a promotion and whatever, because for them, they don't make enough money to rent an apartment, so we have to try and find them a room. And so it's all those challenges. So we are now pulling out targeted groups of people that we can give that intensity to help them do that. We can't do it with everybody, but we're pulling out our targeted, our higher risk group.
Thank you.
Okay.
Okay, we're gonna move ahead. Resolutions, I believe the commissioner had a resolution for us to review. Came late, it was being revised.
Too much paper in my lap.
Thank you.
Thank you.
How do you have one on your desk? You just gave me that.
It's the same one I had. Either that or I saw it on an email and I copied it. That's how I had it on my desk.
First of all, I want to say that this is totally inappropriate. I have not seen this, and I thought the policy
We're
was
gonna discuss it now.
fine, but that's great.
We're gonna discuss it now. Make a motion to discuss. Kitty?
You don't need a motion to discuss a resolution. Go ahead.
Okay. Okay, the resolution was in discussions with Commissioner Parker, because of changes that, he feels that need to be made, to authorize the Commissioner of Health and Family Services to execute an agreement with independent counsel. So it's request for independent counsel, and if you look at the, amount to be authorized by the resolution, it's county share $1,900. And Randy, if you can kind of fill in what your need is there.
Basically, what I am asking for is, there is a provision under Social Services Law, Section 66, which would grant the authority to the commissioner with the approval of the local legislature to appoint attorneys to perform duties that are necessary to be completed. What I've just asked for is for a 60-day review of our Child Protective Services, of our interface between our Child Protective Services and our legal department, in terms of how we prepare petitions, how we submit petitions to the family court, how cases are reviewed and determined to be appropriate for filing in family court, and to just give me an independent look at our structure within our Child Protective Services. There is a pretty big investment into Child Protective Services that the county already has. We're going forward with the addition of, if approved, 3 senior caseworker positions, and so basically looking at a time-limited 60-day review of the current functioning and then a report to be submitted back to me. And there's just the various social service law references within the resolution, and what we're looking to achieve in doing so.
I have 2 questions.
So from what I understand, the Commissioner of Social Services does have the authority, according to social service law, to ask for a report. It's a 60-day report, providing recommendations for child protective service structure, case planning review, specific cases, comprehensive recommendations between legal and child service, with the goal of ensuring that our program is the best it can be to protect kids. Is that correct?
That's it in a nutshell.
Right.
So how
Is
did
this-
the county share get to be 1.900 out of 10?
I mean, Mary, you prepared the CFAR, can you explain the reimbursement on that?
Sure, it's 50% federal, and then, the balance is 62% state on the balance, if that's what's not federal. 5,000 is federal, and then 62% of the 5,000 is state.
That
Okay,
comes out
so-
to 102%?
No, it's
I'm
50,
confused.
it's 62% of 50%.
Oh, okay.
Is this time sensitive, Mrs. Skyder? Is this
Um,
resolution time sensitive?
We would like to have this discussed now and put it to a vote.
Has our legal department,
I have a question. I'm not on the committee, but I was just going, I noticed on the third page of the cover memo that this was not reviewed by purchasing, management budget, law department, county man. This has not gone through the normal process for a resolution. Is there any reason that we can't have people look at it before it's submitted?
The process by which to go through to be, Randy, we could do that, or?
Yeah, if that's what's required, sure.
Yeah,
So-
generally we've not hired attorneys outside of the law department. Well,
Let's take a look.
social services law may permit you to do so. The county's always operated under the law department being the central clearinghouse for all legal matters, hired
Well, I
by
think-
various departments and others, and to bring a resolution before us that some of us have seen and others have not, that you didn't even take through the general legal process is, again, once again, you're trying to do an end around the process to achieve
Okay, I think-
what,
I'm
goals
sorry,
that I'm very
can I
confused about.
interrupt? First of all, we might not, this might not have gotten, everybody's signature, and I'm not saying that that was correct. But to say that we haven't hired outside counsel, I think is totally incorrect.
No,
And
it's
we've
gone
done
through
that many
it's gone through
times
the
in
lead.
many
No,
directions.
it's gone through the law department. This hasn't even been looked at by the law
Okay,
department, that's all.
because that's the first
Oh, no,
thing
no,
that's
no, no, no.
upsetting to me.
No, no.
The second thing that I find, to speak in favor of this, if I was looking at Wadley Donovan or any other thing, we've looked at outside companies, even with the Treasurer's Department, to review a process to say, okay, this can be improved, this is where you have glitches, this is where you have problems. So, an outside counsel to do that, I don't personally see anything wrong with that idea.
I don't think anybody
I-
is saying anything's
No?
wrong with it. I think everybody is just asking, can it go through the normal process? And they probably should go through the law department since we're asking to hire a legal, a lawyer to review a process, and it should go through the law department. I think that's.
But the law department, and help me out on this, please. The law department at the present time, our Sam Yasgur department, that's
County
right.
attorney.
That's the
Department,
county
that's-
attorney's office,
okay.
correct?
Does not, the child protective piece is separate from them, no?
I don't understand your
When
question.
I look at the org chart, your department in child protective does not fall under the county attorney's piece, do you?
You mean the legal department?
Yeah.
No, we're not under the
No.
county attorney.
You know, so I'm a little confused to where we're going with that, because I think we're looking at,
You're not trying to hire another civil service attorney within the family court legal system. You're trying to hire an outside, or at least in the 3 seconds I've had to read it, to hire an outside attorney to review a county process. All that generally means is when we hire attorneys, they're generally hired through the law department. They oversee the contract and make sure we're hiring the right person to get the right achieved result.
Well, I think it is
wouldn't
within
that be part
the,
of an RFP process rather than this? I mean, isn't that an RFP process to make sure that we're getting the right guy for the right job? Isn't
Wait,
that
can
what
I
an
separate-
RFP is?
Can I
Um,
separate process from need for just a moment? Is there any reason not to do this? I think we have to separate those two things.
From what I understand, the Commissioner of Social Services, according to social service law, has the authority to
Right.
do this. And if you read the resolution, there's
I'm
numerous
thinking that-
references to social service law.
But the answer to my question, is there any
We don't know, we
process
just, we just
aside?
got it, we don't know, we haven't.
That's why I'm asking the
And
question.
I
Is there any
understand
reason
that
not
there's some
to do it?
references to, but without, is somebody from the county services even look at it to see if the correct references to social service law?
So what I'm gonna recommend is that we review this resolution and we bring it up in executive.
Absolutely,
Would that
perfect.
work?
Yeah, it's fine,
Well,
I
it-
think if,
it-
as long
it
as
has
it
to
goes
be
through that
reviewed
process
by
and
law.
we all understand what it is
Yeah.
and
Prove as
that
to
all the
form.
references are correct, I don't have a problem with that
I
at all.
think the only
Executive.
difference you need to do is put draft on
Yeah.
watermark, because if there are any changes, then it's not confusing as to which is the draft.
So
and which is
everybody
the-
has the resolution. Is there any further discussion about the resolution?
So this is being tabled?
No, it was not
No,
a
it's-
resolution, it's a
It's not,
discussion.
it wasn't brought up as a vote, doesn't have to be tabled.
Okay.
So we will move it
Sorry.
to,
Executive.
legal to approve form, or to executive, sorry.
Thank you.
So they're approving as to form and content, or just form?
Form.
It'd be form and content, I mean.
So
just make sure
approval
that-
from
That's basically
legal
the
as to
same thing.
form of the draft resolution to be brought up in executive, correct?
Yeah.
Okay, any further questions?
I'm sorry, would you restate this form, Jonathan, you want it to be looked at in form and content? To be
Form only.
Like the
proposed to executive?
normal resolution moved by the law department.
Yeah, we'll just go through the process, that's all.
I don't blame you for doing it.
Okay, public comment. Ken?
I got two things. One is just, from previous resolutions, and there's money on the county side, it's supposed to be signed off by a whole bunch of different people, and as was pointed out by Scott, that there's no documentation that was done. The other thing is, what do I do as a citizen when I see two kids riding a ATV during school hours, or I see a mother going to a convenience store and have a stroller, but there's other two kids of school age? What do we do in the community to make sure that they're in school? Because there's two parts to this, since I used to be in education. There are sometimes the administration is very happy not to see some kids come to school, okay? And that's a fact. So, they're not gonna be due diligence to make sure they're being chased after. So that becomes a part of the equation too. But what does a community do to help raise the child, since we're already paying to raise many of them, to make it sure that they're in school, if they see something that's wrong?
They still have them in schools?
Yes, they do.
All of them?
I know Fallsburg does.
I know the
Are you really?
attendance officer
I
makes
thought that was a
calls.
myth.
I
just
believe,
I
knew it wasn't a myth.
I believe Monticello has one as well.
Sorry. I would like to wrap it up. Any further public comment? Motion to
Motion to
adjourn?
adjourn, so moved.
Eat lunch.